In this video, I'm going to show a kinesiology taping technique for lateral epicondylitis, also known as tennis elbow. So we've cut two strips. One is an eye strip, round about 6 squares, and we've cut some finger holes in. These are performed by just folding over the end of the tape and cutting a semicircle or triangle in. This is where the finger holes are going to go, and then the tape's going to move up the forearm. This smaller strip, the decompression strip, this is actually going to go over the site of pain. So we're going to start with your client in seated, or they can be in lying, and we're going to ask them to extend the elbow and then flex the wrist. Rip the tape and take off the top of the finger hole compartment. And then you're going to pop the tape through the middle and the ring finger, securing the tape on their palm. They're going to keep the wrist flexed, pull the tape to release the backing strip. The wrist is on stretch, so we're only going to apply a 25% stretch up over the hand, the wrist, and then we're going to have 50 to 75% stretch up the forearm, over the site of the pain, so over the lateral epicondyle, and then using backing tape to secure the adhesive. We're then going to flex the elbow and just rest the arm in front of them, and we're going to use this tape over the actual site of pain. This time we're going to rip the tape in the middle and then use the two outside parts as the anchor. We're going to have 75% to 100% stretch on this, and this is going to go over the actual site of pain. So you can mark it or you can palpate up, and the client will let you know where the site of pain is. So 75% over there, and then using the backing strip to secure the tape. The stretch is on the middle of the tape and no stretch on the outside. So this will create that lift, reduce the inflammation around the injured site. So this is for lateral epicondylitis or tennis elbow. This will reduce the pressure off of the forearm muscles, the wrist extensors, and we could always use this type of taping technique for the medial epicondylitis known as golfer's elbow. So we'll demonstrate this on the other arm. So to treat medial epicondylitis, we can use a taping technique. So very similar to the lateral epicondylitis taping technique, but we're just going to put it on the inside of the arm. So we've got the finger holes again, similar length depending on your client's arm size. We're going to rip through the finger holes. You can take the tape off or leave it on, just try not to touch the adhesive. And we're going to ask the client this time to turn their palm over, and we're going to extend the wrist this time. So through the ring finger and the middle finger, taking off the tape, backing, sticking the tape down onto the dorsal aspect of the hand. Pull the tape and it will release the backing strip. Make sure the wrist is extended. We're going to stick the tape through the palm and then add some stretch through the tape around about 75% as we move up over the site of pain. You can palpate the area, so you can locate the area of discomfort, and then this is where we're going to apply the decompression strip. Using the stretch in the middle of the tape, so anchor either side, have 75 to 100%. This is going to be applied across the medial epicondyle, securing the tape on both sides. Use the backing tape to make sure all of the sides and the edges are stuck down so they don't peel off. Make sure before you apply any tape that you've ensured that all the massage medium has been wiped clean around the whole area. If you cut the tape and you put some stretch on and it starts to translate all the way up the arm, you can trim the tape rather than having it up the client's bicep. So just to recap, we've performed a taping technique for lateral epicondylitis, known as tennis elbow, and medial epicondylitis, known as golfer's elbow. This tape is also waterproof, some more than others, but usually you're fine for your clients to have a bath or shower. They will just dab the area opposed to rub it, and you can leave the tape on for between 5 and 7 days for optimal results.